As a teacher, I'm on my feet all the time, and my legs hurt when I got home, and I really didn't want to do anything else because my legs were exhausted. So I'd have to sit down, prop them up, and do those kind of things before I could get going again.
Those spiders are there because of the venous hypertension that develops with damaged larger veins. The varicose veins allow the pressures in the leg to expand, and the spider veins and smaller veins dilate up as a response to this hypertension. Previously, we really only treated severely symptomatic patients and used compression therapy for those patients that were more of a symptom. Compression therapy being stockings, support hose that gives external support. But this just controls symptoms, and it doesn't help the underlying cause of the problem, the damaged valves in the vein. The way the valves work in the vein is to push blood back towards the heart. They're little flaps that open and close, and in this process of causing the blood to flow towards the heart, the valves keep the pressures in the legs down. When those valves are damaged and the wall is stretched open, the valves don't hold. The blood actually travels in a retrograde fashion, or refluxes through the valves, and patients develop the symptoms of pressure by popping these large varicosity veins out. They will develop spidering, and the symptoms of aching and tiredness and heaviness and swelling. So once the valves have been damaged in the vein is sort of useless, and blood pools in the leg. That pooling of blood affects the tissues in the skin, and this becomes a very significant problem for the patients. They're unable to work often, and they have to wear these tight, hot compression garments. Some of the real important changes have been in the development of color duplex ultrasound. This allows you to better define the vein problems, to localize the damage in the veins, and to determine whether the valves in the veins are working. Also, a lot of patients that we treated before, we're finding that have multiple saphenous veins. In about 15% of patients, there's an extra channel of flow. So diagnosis itself has made the treatment more effective. What happens is that the veins are treated by placing a small catheter into the vein and directing it on the ultrasound to the junction of the saphenous vein. And there, the tip of the catheter will heat the vein and cause the vein to collapse. And as this vein is heated, it closes down and of course closes off with blood material that pools there. And eventually the body will remove the vein as if it were stripped out, but it takes a process of several months to a year for this process to be completely completed. But the relief of symptoms is immediate. Patients that have had these aching, tired legs will notice within a day or two that their legs feel better. There is an advantage of doing this now because it's in an office setting rather than the hospital. So the procedure is local anesthesia. The cost of using hospital facilities is not there for the patient. It is much less cost involved with doing a procedure in a vein center. The relief of symptoms is immediate. Patients that have had these aching, tired legs will notice within a day or two that their legs feel better. The downtime is very small for the patient. Usually they're able to put on support hose the following day and they can return to their normal activities. Another advantage is the safety because, of course, you're not dealing with a general anesthesia for the patient or being in a hospital environment with infections. Well, another area of breakthrough has been the development of treatments for varicose veins and for closing the saphenous system rather than taking it out through stripping. These developments have come with the development of the radiofrequency catheter, the venous closure, and the development of the same sort of treatment with the laser tip catheters, the EVLT, or endovascular laser therapy. This has made the procedure now office practice and accessible to the patient in a much safer environment, as well as a much less expensive procedure. The treatment with sclerotherapy and with laser for spider veins has improved a great deal. Sclerotherapy used to be done with hypertonic saline, which was painful with injections and often left some staining in the tissues. The newer agents now are not painful, and the patient can actually have much more of the vein treatment done in one setting, which is a cost savings to the patients. Also, the allergic and inflammatory responses that were seen with other agents are minimal, very, very minimal nowadays. Another improvement has been in the treatment of spider veins with the use of the laser and improvements in the laser. We now have a laser that will treat with a variable spot size, and this allows us to direct the energy just to that size of the vein, and it will, with enough intensity, to obliterate the vein with one pass. This makes the treatment of spider veins much more effective, as well as cosmetically a good result. There's a procedure called ambulatory phlebectomy that lets you remove even the large varicose veins through a pinhole, and that incision is made with an 18-gauge needle, which is not very big, and the vein is actually teased to the surface and removed in portions through these little ambulatory phlebectomy openings. What is left is usually a little pinpoint of a scar, and if any scar is remaining, it's matures to a little white dot if it's a scar at all. The cosmetic result is much better than it has been for doing vein strippings. So overall, the new treatments of varicose veins has made a big difference in people's lives, not only in protecting them from skin breakout and dermatitis, but controlling and managing the symptoms that used to be treated with a support hose. The results, the patients, over 90% are relieved of their pain, and they get a good response to the treatment. The effectiveness is as good or better, as well as safer than doing vein stripping procedures.
Since the procedure has been done, I can go home and work in the yard after being on my feet 8 or 9 hours.
And after I had the procedure, it's just like having new legs. It's wonderful. I'm not as tired. I don't have cramping like I had at night, or tired legs at night, and those kinds of things. So I've been really, really pleased. It's not a bad procedure at all. And once it's over, you just go home, and I was pretty much back to work the next day. I felt like I had young legs again, and I could just dance all night.